Okay, the part 2 of our discussion today is the atrial flagellates as well as the intestinal flagellates. Okay? So, pag sinabi pong flagellates, again, the locomotory organelle po nila would be the flagella. Okay, so yun yung parang string-like na structure nila or organelle nila as their locomotory organelle. So, they are also under the phylum Protozoa. However, they are under subphylum Mastigophora, class Zoomastigophora. They are the intestinal and the atrial flagellates. Okay, so ayan po sila. We have the intestinal species. We have the Giardia intestinalis or Giardia duodenalis or the Giardia lamblia, as you may know, kasi yan yung sinilip ninyo under the microscope. Chylomastix mesnili, Dianthemeba fragilis, Trichomonas hominis, Enteromonas hominis, and the Retortamonas hominis. Extraintestinal species, we have the Trichomonas tenax and the Trichomonas vaginalis. So here are some pictures of your flagellates, no? And you may have noticed, no, during their trophozoite stage, doon lumilitaw yung kanilang mga flagella. Similarly, if as you may have recalled during our previous discussion, yung mga sarcodina naman or yung mga rhizopods, during their trophozoite stage, doon lumilitaw yung kanilang mga pseudopods. Okay? So, ayan sila. Okay. So, for the morphology and life cycle, so motility is due to their flagella in their trophozoite form. And trophozoite are more resistant to destructive forces, the surviving passage into the stomach, unlike the amoebic trophozoites. So, ayan po yung general life cycle of non-pathogenic flagellates. No? So, sobrang simple lang, no? So, you can see, the diagnostic stage is their cystic stage as well as their trophozoite stage. So, same lang, no? And then, their infective stage, maaring cystic stage for Enteromonas and Restortamonas. Trophozoite stage for Pentatrichomonas hominis. Okay? So, ayan. Ayan. Lab diagnosis, the specimen is usually stool, especially kapag intestinal. Okay, liquid, loose, or soft stools para makita ka ng trophozoite stage. Similar din. So, it is just similar dun sa discussion natin earlier. And form stools kapag cysts. Saline and iodine wet preparation. And ito po, please take note. Yung undulating membrane, these are fin-like structure connected to the outer edge of some flagellates. Often, they are not visible under the microscope. So, for example, kung yan yung inyong trophozoite, no, meron siyang parang kulot sa katawan niya. No? And that is their undulating membrane. Pag naman axostyle, that is their support structure organelle kung saan nakaakibat yung kanilang flagella. Okay? So, again, undulating membrane, it is a fin-like structure connected to the outer edge of some flagellates, and they are often not visible. Pag axostyle naman, these are rod-like support structure in some flagellates. So, ayan. Hindi ma-play. Paano pa-play ito? Wait lang, play natin. And hopefully nakita niyo yan, no? So that is an example of your Giardia lamblia trophozoite. Okay, I think later mas may maganda tayo mga pictures na. So the life cycle is once you have ingested, no, the Giardia lamblia, either the cyst or the trophozoite form, no, either way possible yan. The gastric acid stimulates the cyst to exist in the duodenum. Ibig sabihin, from cystic stage, pwede siyang mag-transform into trophozoite stage if cystic stage yung nakain mo. If trophozoite stage naman, wala nang mangyayari excess because it's already in the trophozoite stage. And then those trophozoites would proceed to form their asexual reproduction, which is binary fission din. And yung binary fission na yun would infect the gallbladder and as well as the bile duct. Tapos, yun na yun. And the life cycle repeats itself. Tatain na siya, then life cycle repeats itself. Ayan. So, ayan po yung kanilang motility. Ayan. Falling leaf motility. Okay. So, as you can see, no? Ayan. As you can see, parang dahon na nahuhulog, no? Falling leaf motility. Sino po yan? Giardia lamblia or Giardia intestinalis or Giardia duodenalis. Pare-pareho lang po yan. Okay? So, ayan po yung kanyang saan ba yung kanyang parang nawawala yung ito pala na nasa first page po lang. So, ayan po yung kanyang picture, no, ng kanyang old man with eyeglasses. So, ito po yung kanilang tinutukoy na undulating membrane. Okay, and then this is the axostyle. Okay, this is the axostyle. Okay. Now, so, pathogenesis and clinical symptoms recovered from patients with diarrhea without apparent cause asymptomatic. Giardia intestinalis is the only intestinal flagellate that is pathogenic. Okay? Again, yung ibang mga babanggitin natin, they are all commensals na intestinal flagellates. Sino lang yung pathogenic? Si Giardia intestinalis. Ibang libro, pangalan niya po is Giardia lamblia. Sa ibang libro, duodenalis. Siya po lahat yan. Okay? Okay, intestinal flagellates. So, number 1 is Giardia intestinalis, also known as your traveler's diarrhea. So, nagkakaroon ng light-colored stools with high fat content, also known as steatorrhea. Wrong spelling po ito. Steatorrhea. Ito po yung tamang spelling with letter A. No? Steatorrhea. Light-colored stools with high fat content. So, fat-soluble vitamin deficiencies, folic acid deficiencies, hypoproteinemia with hypogammaglobulinemia, and structural changes of the intestinal villi. Okay? So, ano ba? Ayan. So, sa cystic stage, paki-take note na lang po yung mga linagyan ko ng hindi nagsusulat to. So, ayan yung ating Giardia cyst, ovoid shape. Ang kanyang trophozoite are pear-shaped, teardrop shape with falling leaf motility. 4 pairs of flagella. So, ito po yung kanyang life cycle as I have mentioned earlier. Yan lang po yun. Ayan po yung tsura niya. So, basal bodies of flagella, nucleus, parabasal. Okay. Next is your chylomastix mesnili. So, it is your lemon shape with clear hyaline knob for the cyst. No? Meron siyang tinatawag na shepherd's crook fibrils. Shepherd's crook fibrils. Ito po yan. Shepherd's crook yung tawag natin dyan. And then for the trophozoite, pear shape, stiff, rotary, directional, and 4 na flagella with prominent cytosome. Again, this is non-pathogenic. So, the only pathogenic is Giardia lamblia, or Giardia intestinalis, or Giardia duodenalis. So, that is your chylomastix mesnili. The next one is the Dianthemeba fragilis. Dianthemeba fragilis, infection is usually symptomatic, no, with diarrhea and abdominal pain, sometimes blood or mucoid stool. Most of the times, asymptomatic carrier ang meron yan. Okay, again, this is just non-pathogenic. Nagiging pathogenic lang kapag immunocompromised yung patients mo. So there are no known cysts, only trophozoite stage. Irregularly round shape sila with progressive broad hyaline pseudopodia. Next is the Trichomonas hominis, no? Trichomonas hominis, wala siyang cystic stage, no? However, meron siyang full body undulating membrane. Okay? Pear shape and jerky motility. Okay, same with the vaginalis motility. Later, I will show you kung ano itsura niyan. 3 to 5 anterior flagella, 1 posterior flagella. Axostyle extends beyond the posterior end of the body. Ito yung axostyle niya. So, before we proceed, meron tayong tinatawag na costa. Ito pong nasa gilid na to. We call that costa. No? Makikita nyo yan sa mga trichomonads. No? Costa. Next, we have the Enteromonas hominis. Okay? By the way, in other books pala, Trichomonas hominis is also referred as Trichomonas hominis. Okay? Not to be confused na tatlo kasi sila dalawa kasi silang hominis. The other one is the Enteromonas hominis. So pag sinabing Trichomonas and Trichomonas hominis, iisa lang 'yon. Pero pag Enteromonas hominis, it is a different species. So Enteromonas hominis, meron siyang cystic stage. So meron siyang cystic stage 1 to 4 binucleated with central karyosome on opposite ends of the cell. Ang trophozoite niya, it is oval, half circle jerky motility and with 4 flagella. We have the Retortamonas intestinalis. Ito naman, it is lemon shape or pear shape, yung kanyang cystic stage. Ang trophozoite niya, again, it is ovoid and jerky motility. However, it has only 2 anterior flagella. And next, we have the Trichomonas tenax. Wala din siyang cystic stage. Same lang, oval and pear shape. 5 flagella in total, same with Trichomonas hominis. However, the main difference is the undulating membrane is only 2/3 of the body. Hanggang dyan lang. Si Trichomonas hominis, full body siya. Ito po, 2/3 lang. The axostyle is thick and curves around the nucleus. And next is you have the Trichomonas vaginalis. Now, this one is pathogenic only on women, no? The men can be carrier. However, sometimes it can be symptomatic in what we call the persistent urethritis or the inflammation of the urethra of the men, no? However, for women, if they are infected with the Trichomonas vaginalis, no, meron tayong persistent vaginitis or yung continuous na inflammation ng kanilang vagina. So, infected women, nagkakaroon sila ng foul-smelling, greenish-yellow liquid vaginal discharge, and then nagkakaroon din ng burning, itching, or yung chafing sensation, no, sa kanilang vaginal area. Okay? So, meron din tayong tinatawag na infant Trichomonas vaginalis infection. So, kapag yung magulang nila infected with Trichomonas vaginalis, malamang sa malamang pag manganganak, dadaan dyan yung bata, mahahawa siya, no? So, infants with both respiratory infections and conjunctivitis. So, pupunta sa lungs nila, also with their mata, no? A symptomatic carrier state often frequently occur in men. So, that's why pag vaginalis, madalas sa women talaga nakikita. So, again, no cystic stage. So, ovoid round, pear shape, rapid jerky motility. Same lang sa mga trichomonads. So, their main differences would be their flagella. Ito, 4. Yung mga kanina is 5. And then, the undulating membrane is half of the body. Yung isa is full body, si hominis. Si tenax is 2/3. Si vaginalis is half of the body length. And it has prominent axostyle. So, if you recall, no, during our parasitology lab, hindi ko na siya masyadong pinafocus because hindi ganun ka-significant yung nasa prepared smear. Hindi niyo siya ganun na-appreciate. Especially if you plan to work here in our province in Pampanga, especially in Angeles City, madami-dami yung mga pasyente na nagsasuffer ng Trichomonas vaginalis. And ito po yung itsura nila. Yan yung jerky motility. Ayan. As you can see, no? Malikot. Ayan, malikot sila. So, yan po. So, pag nakita nyo na may ganyan yung pasyente nyo, expect nyo na medyo literal na namamaga and nangangati yung kanyang vaginal area. Okay? So, ayan po. So, undulating membrane, kalahati lang. Okay? Next. Yun na yun. Ganun din yan. Ayan po. So, tenax, vaginalis, and hominis. Okay? Pwede nyo pause yan. Tapos, i-review ninyo ano yung mga differences ng tatlo, especially to their number of flagella, kung hanggang saan yung undulating membrane, at saka yung kanilang axostyle. And that's it. No? Tapos na. So, expect a quiz on Friday because most likely we will only have one face-to-face meeting na next week. I think yun na yung pinaka-last if ever matuloy man. No? So, we will have a quiz na on our laboratory. Yung first lab hour natin, okay, gagamitin ko yun for the quiz. Okay? So, quiz on Friday, the topics would be intestinal amoeba, free-living amoeba, ciliated amoeba, intestinal flagellates, and atrial flagellates. So, basically, lahat ng diniscuss natin today, yun yung mga pagki-quiz ninyo on Friday. Again, if you have any other questions, don't hesitate to email me or message me on Canvas kasi diretso naman yan sa email ko. Especially for any clarifications, no? Kasi again, this is online, so hindi na ako talaga or kulang na talaga yung mga apparatus ko for online teaching, no? So that's it, and thank you.